So caloric restriction, so this is a quote that was published in 2019 in the International Journal of Molecular Science. I think it's really valuable to repeat here. So caloric restriction, i.e. the reduction of calorie intake by 10 to 40% without causing malnutrition, has been proven to be by far the most effective intervention that can extend the maximum lifespan. So that's pretty profound, you guys, right? So when we think about how important it is to not just eat healthy diet, but also to challenge our body to think about reducing that caloric intake, and it might be intermittently, it might not be a daily thing, but this is where the research is going. Now, the challenge is particularly in some of your and some of my patients that have a little bit more of a body composition complex. When you start to think about, okay, what can I do for them? It's really easy for people to go too far with this stuff. And so you have to be mindful of your patient population in that regard and not encourage behaviors that ultimately could be harmful in the long run. So just mentally take a note there. So why does caloric restriction work? Does this slide look familiar? We are, very similar to what we're talking about. Calorie restriction, reduction of insulin and IGF signaling, right? Insulin growth factor signaling. Then that stimulates mTOR, right? So, or, if insulin was high, stimulates mTOR. If calorie restriction is there, it inhibits mTOR. And then inhibition of mTOR then leads to autophagy. Autophagy, the cleanup crew, we've talked about this. Super important. With calorie restriction, the ratio of AMP to ATP goes up, AMPK goes up, and then again, autophagy, right? So here we are. So this is really where you want to think about, why does calorie restriction work? And we are going to cover metformin being one of the pharmaceutical agents. So just know that there's relevance here. mTOR, okay, again, we've seen this, and the value is this. It's just super important to understand that we want to biohack a little bit in regards to how we can use nutrition, dietary interventions to modulate how someone's growth signals can be turned on and then turned off, and make sure that we're doing anti-aging stuff, but they're still able to gain muscle tissue, and it's not just an all or one. So just being aware of that. Again, this is why caloric restriction works. I brought these slides back over because I wanted you guys to remember that this is why we're doing this, is these mechanisms are why it works. So what reduces mTOR and increases AMPK? Well, caloric restriction and autophagy, right? So we're seeing that autophagy is really where the rubber meets the road. It's the antidote to senescence, repetitive, but again, important. So let's think about strategies for caloric restriction. Why do they work? Okay, beyond being in the fasting state, the production of ketones stimulates these specific trophic factors, okay? And trophic factors that are listed here, BDNF, FGF2, and VEGF. So I'm just gonna point out, when you're doing intermittent or metabolic switching, okay, so energy restriction, fasting, exercise, ketones, at least for those who are able to get into a ketotic state, nutritional ketotic state, it's a key differentiation, then can upregulate brain-deriving neurotrophic factor. That's a huge trophic factor that's really, really important to help support brain health. I mentioned earlier with my work with MS. And so that's an area that I think is super important. That then affects different transcription factors, NF-kappa B being something we want to downregulate, and then NRF2 being something we want to upregulate. So those are just a couple examples of how we want to use intermittent fasting strategies. When we think about metabolic complacency, then here's our friend insulin resistance. And then we see trophic deprivation, disengagement of adaptive stress signaling pathways, mitochondrial dysfunction, impaired autophagy, synapse degeneration, right? So the creation of these new pathways, oxidative damage, et cetera, et cetera. So It's all the same story, but it is important to think about, okay, when I prescribe intermittent fasting, what am I trying to look at the outcomes? And what biomarkers do I want to follow to look at these outcomes? So insulin being a really obvious one, and also widely available at any lab. So this is something that you can absolutely watch and see. IGF-1 too. IGF-1 is widely available in most labs, so these are things you can definitely follow. So organ systems affected by caloric restriction, intermittent fasting, increased brain synaptic plasticity, neurogenesis and cognitive function, increased cardiovascular function, so improved cardiovascular function, mobilization of fatty acids and improved insulin sensitivity. So what is that called? Lipolysis, right? So we want to mobilize those fatty acids, beta oxidation, right? And ultimately oxidative phosphorylation in the electron transport chain. These are things we want to stimulate. And then reduced inflammation. Ultimately, we talked a lot about how the importance of reduced inflammation goes hand in hand with insulin resistance. So this is what we expect to see with intermittent fasting protocols. So how do you do it? This is probably the slide that you've been waiting for. Choose a window between 4 and 8 hours of food consumption. So for some patients, they might be willing to go pretty strict right away. For others, you might want to do something more gradual, 11 a.m. to 7 p.m., something like that. The rule is they just do not consume any calories outside of this window. And studies demonstrate even if they eat their normal diet outside of this window, there's still benefits. With my patients, I strongly suggest a Mediterranean diet or Mediterranean keto diet. So that really emphasizes those healthy fats, some of those phytonutrients that are densely packed into plants that are brightly colored. So I typically am emphasizing leafy greens, cabbage, all sorts of, again, the unsaturated fats, omega-9s, avocado, olive oil, of course, protein. So thinking in terms of how can we incorporate diet with intermittent fasting, but again, the research shows that even if they ate their normal diet, we're still gonna see a huge benefit here. So it's pretty cool to see that.